I'm here with Bonny Specker, epidemiologist from South Dakota State University, who is going to give us a COVID-19 update from what has happened with COVID-19 over the last week. And also, she's going to talk to us a little bit today about excess deaths. And Bonny, what are excess deaths?
Thank you, Chelsea. This week I'd like to talk about excess deaths. And excess deaths are simply the difference between the observed number of deaths that occur over a specific time period and the expected number of deaths. And during COVID, people might use excess deaths to get information on the number of deaths that can be either directly or indirectly attributed to COVID. Comparing deaths from all causes with and without COVID can give you some insight into how many excess deaths are identified as due to COVID or due to some other cause. And these deaths that are due to some other cause, if there are a lot of them, it could be an indication that there are COVID deaths that are not being coded as COVID, or it could be that there's excess deaths occurring due to either healthcare shortages or an overburdening of the healthcare system, or perhaps people aren't going to the hospital for treatment when they should be, and therefore these deaths will increase. So how do people determine excess deaths? Well, every state in the country provides the National Vital Statistics System with the observed death counts. Now, the reporting of death data by states can be delayed. There, is a long process for that. So there are statistical methods that can be used to account for the incomplete data. The CDC also uses methods to calculate the expected number of deaths for each week. And this is based on historical data. And what I'm going to show you today, they go back to 2013 to calculate these expected number of deaths for each week of the year. And because there's variability in that, or error in making those estimates, they set an upper threshold based on the 95% prediction interval. And what this is telling you is that in the future number of deaths per week will fall under this threshold 95% of the time. So it's giving you some measure of error in those estimates. And this is shown on this graph. On this axis, we have the number of deaths per week. This is for the United States. And this orange line is the threshold for excess deaths. So this is that 95% prediction interval. And here, the blue vertical bars are the predicted number of deaths from all causes after taking into account those delays of reporting. And you can see that if you took the mean, it'd probably be somewhere around what you're observing. And so this is that possible error. And these little green or red crosses, this is showing you that these weeks, the number of deaths were above that threshold. And it doesn't happen very often. Here we have COVID out here where we have many excess deaths, and we'll get back to that later. But I wanted to talk about this area too. But before we get there, this is just showing one particular week. You can go to this website, the reference is down here, and you can click on a particular week, and it gives you this information. It's the week ending March 7th. There were, on average, you would expect 58,383 deaths that particular year. Now, the upper bound threshold was 60,000. So if you're above 60,000, they would say that's a significant increase, or you have excess deaths more than what you would be expecting. And here we have the predicted. So this is what you actually observe, taking into account the delays in reporting of 59,000. So this particular week, we had above average deaths, but they weren't above the threshold. Now, if we go back to this slide, there's this week or this time period back here in 2018 where there are quite a few weeks where you have excess deaths. One other thing I want to point out about these graphs is we have this seasonality of deaths where more deaths occur in the winter months than in the summer months. And this is typically seen. If we go back and look at that 2018, you can see here, and this I think is an amazing graph. It provides a lot of important information. This is pneumonia, influenza, and COVID mortality or deaths over quite a long period back to 2017 to this is ending November 14th of this year. On this axis, we have the percent of all deaths due to pneumonia, influenza, and COVID. And over here, we have the actual number of deaths. These two black lines, this is the threshold, the upper one, and then the baseline. So you would expect the number of deaths to lie within this particular band right here, represented by these two dark lines. If you look at the red line, this is the actual percent of deaths due to COVID. So this, or pneumonia and influenza. So this red line, you interpret that through this axis here. And you can see that about 5 to 8% of the deaths are due to pneumonia, influenza, and COVID over this time. But then you have this peak here, and that corresponds to this increase in flu. These yellow shaded areas are the number of deaths that were coded as being caused by flu. And you can see that 2018 was actually a very bad year for influenza. There were a lot of deaths. Here's the deaths in 2017 and 2019. You can see that those numbers are smaller than what you get here in 2018. So there was this peak caused by these excess flu deaths here. And then when we get to 2020, this blue area is actually COVID-related deaths. So you can see that COVID-related deaths are significantly greater than anything we've seen from influenza, at least since 2017. And this red line is the combined percent of deaths due to pneumonia, influenza, or COVID. So it's normally running about 5 to 8%, and back in early 2020, we're up to 28% of the deaths being caused by pneumonia, influenza, and COVID combined. Now, going back to this particular chart, this is still the United States, but instead of all causes of death, this particular graph gives it broken down into all causes other than COVID and then COVID-related causes. So the COVID deaths are identified here with the blue bars. So here we have that influenza deaths back in 2018. Here we have the COVID-related deaths. This put us above that threshold for every week in 2020. But the interesting thing to note is that we also have several weeks here in 2020 where deaths from other causes other than what was coded as being COVID-related are above this threshold. So we have this big period here where we have quite a few months or weeks, I'm sorry, of excess deaths, and also in here. Now, if we look at South Dakota, the graphs aren't quite as pretty, and that's because we're dealing with fewer numbers of deaths. In those other graphs, these numbers were 60,000, say. Here we're talking about no more than 300, but on average about 150 deaths per week. But it's the same graph, just more variability in the data because of the smaller numbers. But you can see here that this threshold We exceeded it 1 week a year in 2018 and 2019. It was never exceeded in 2017. And in 2020, we have now already exceeded the threshold 11 times. And if we break this down into COVID and non-COVID deaths, you can see that we started seeing these COVID deaths back in March, and more recently, they're quite a bit higher. And if we zoom in on this particular area, you can see that in 2020, all causes of death other than COVID exceeded the threshold. So if we're ignoring those blue lines, 3 times. So back here in March, we exceeded as identified by that red X. And then we also exceeded it in September here, where the green line is above the threshold, and also in November. Now, if the COVID-19 deaths are included, the threshold has been exceeded 11 times. Now, we can take the expected number of deaths and based on the average, and we could subtract what we've actually observed from that to get at excess deaths. And as of November 14th, this last week, there have been an estimated 883 more deaths than what you would expect based on the average. But on November 14th, there were actually 621 COVID deaths reported on the Department of Health dashboards. So there's that difference of about 250 deaths more than what we would have expected. So in summary, during the 3 years of 2017 to 2019, the weekly observed deaths exceeded that upper threshold twice. Since March of 2020, there have been 11 weeks where deaths from all causes exceeded that upper 95% threshold for expected deaths. There were 3 weeks where deaths from all causes other than COVID exceeded that threshold, and whether these excess deaths that are not coded as COVID are really COVID-related deaths that were misclassified, or whether it's a result of strain on the health system or people not going to the hospital when they should, isn't really known. But there do appear to be these weeks of excess deaths during the COVID pandemic that are not coded as being COVID related. In addition, we have the obvious COVID deaths causing us to have more deaths than expected. So that's that for this week.
Well, thank you, Bonnie. What else do you have for us this week? What has happened over the last week with COVID-19?
Well, it's been a pretty good week. I don't know how much of that is because of Thanksgiving and delays in reporting that typically occur over a weekend are now spread out to delays over 4 days. But things have looked better. We just need hope that it stays that way following Thanksgiving. Brookings County has had substantial spread. We are not below that 34 cases per week that we need to get to moderate spread. There were 175 new cases this week compared to 191 last week. 466 active cases on November 29th compared to 446 the Sunday before. There have been 79 people that have been hospitalized at some point. 5 new admissions this week compared to 4 in the previous week. 16 total deaths. Fortunately, there were no new deaths in this past week, but whereas there were 3 in the previous week. The test positivity really dropped this week. Among people tested, it got down to 17%. And using tests done as the denominator, it was at 9%. It did decrease from 28 and 13%. A lot of that was probably due to all the testing that SDSU did on the students before they went home for Thanksgiving. South Dakota, 79,900 cases, 6,835 cases this week compared to 7,684 cases in the previous week, so down a little bit there. 16,930 active cases, about the same as it was the Sunday before, 16,897. 4,468 people have been hospitalized with COVID. There were 374 admissions this week compared to 450 in the previous week, so that's also down a little bit. As of November 29th, yesterday, there were 544 people hospitalized in South Dakota with COVID, and that's down from 577 the Sunday before. There have been a total of 943 deaths. 518 of those, more than half of them, have occurred in the month of November. It was a pretty bad month for deaths. 124 deaths this week compared to 175 in the previous week. Test positivity for the state is still pretty high, 45% among people tested compared to 18% among tests done. Those numbers are a little bit lower than last week's test positivity. This is the number of cases for K-12 and higher eds, both students and staff. And you can see here, this is the K-12 students. The slope of this line started to flatten out a little bit. It was going pretty steeper here and kind of took a slight turn. This, you know, whether this is really fewer cases or a short school week is hard to tell. I guess we'll see what happens in the next couple weeks following Thanksgiving. In the US, I think a lot of these data are reflecting the Thanksgiving weekend. We had 1.15 million new cases this week and 1.22 million in the previous week. These just seem to be a reporting issue, I think, and at least that's what I'm thinking, whether this is really a decrease or just a reflection of the 4-day weekend. We'll have to see. 10,464 deaths reported this week and 10,534 the previous week. Worldwide, we do see this little tiny, a smaller decrease. So the United States is about a fourth of the world's cases. So if the United States was just celebrating Thanksgiving, has a delay in reporting, it's going to be reflected to a smaller degree in the world. And you see that here, 4.07 million cases this week versus 4.17 million in the previous week. There were 769 deaths this past week, about 10,000 deaths a day, compared to 68,364 deaths in the previous week. Kind of numbers that are getting very hard to comprehend. I updated this. Again, it'd be best if people are traveling to go to that website. You don't have to have a subscription to get to it. No new states this week, and there were some states that had possible restrictions at a county level that no longer have that. I can't remember off the top of my head which ones they were, but they were down at the bottom last week's presentation. They don't have those restrictions right now. So please protect yourself and others, wear a mask, socially distance, wash your hands and get tested, and stay home when you can. You know, we aren't over this yet, and we need to really be persistent and persevere with our safety precautions. So.
Well, thank you, Bonnie. I appreciate the update, and we will hear from you again next week to find out what's been happening with COVID. If anyone has a question for Bonnie, please email us at that email address that is included in the description of this video, and we will do our best to get those questions answered for you. Thank you, Bonnie.
Thanks, Chelsea. Have a good week.